Weight discrimination in healthcare. What is weight discrimination? Well, it refers to the unequal and unfair treatment of people because of their weight. It includes bias against particular people, making assumptions about their abilities and characteristics. It affects fat people at much higher rates, and it leads to increased bias and stigma towards fat people. It affects fat women at higher rates, as 45% of fat women report weight discrimination compared to 28% for men. Weight discrimination in healthcare. It refers to how patients are often denied diagnosis or medical procedures on the basis of their weight. A person's chances of being discriminated against increase as their body weight increases. Healthcare providers often refuse to treat patients based on their weight or body size. Some have a set weight limit on the patients that they would accept. Patients are often misdiagnosed or simply left with no answers to their concerns. Often prescribed weight loss, patients are left with no proper diagnosis and are forced to suffer from illnesses that result in death. Weight discrimination is legal in 49 states, leaving patients with no protection when they are left untreated. Doctors undiagnose women, leaving 70% with medically unexplained symptoms. These disparities increase for Black women who are more likely to die from breast cancer due to this undertreatment. Real lives in real voices. Ellen Bennett lived from 1954 to 2018. She was a daughter, a sister, an aunt, and a lover of vintage clothing. She lost her battle to cancer on May 11, 2018. She experienced painful symptoms and sought medical intervention only to be prescribed weight loss. She never was tested until a week before her death, where she was diagnosed with inoperable cancer. Her dying wish, listed in her obituary, was that women of size make her death matter by advocating strongly for their health and not accepting that fat is the only relevant health issue. From a social media study conducted by anonymous writer @YourFatFriend, her tweet asks, "Fellow fats, have you ever been misdiagnosed by a doctor due to your size? What were the repercussions of your misdiagnosis?" One user replied, "Told my doctor about back pain I had for years. Said it was probably due to my size. One day, back pain was so bad, I went to the ER. After a multitude of tests, I found out I had an infection that killed off my kidney and was spreading. Kidney had to be removed before it attacked my other organs." Another user replies, "I was misdiagnosed for 5 years, give or take. Turns out, I had cancer. They took out my left lung in 2012.
As I was a bigger child, I often got subtle remarks from pretty much everyone in my life, from strangers to people in my personal life, and especially from health professionals, about my weight. So I tried to avoid going as much as possible, and I don't know what age I made that decision in my head, but it was pretty young because I don't remember a before then, before I tried to avoid going. But when I was 11, I got the standard flu, but I had a pretty bad persistent cough, so my mom took me to the doctor. And when I got there, I thought she was going to get out a stethoscope and listen to my lungs and see if I had any residual stuff going on in there from the sickness. But instead, she took this opportunity to tell my mom about the Child Weight Watchers program, how I qualified, and how my lingering cough, would not have happened if I was basically in a different body, if I was much smaller. And the whole session kind of turned into a body shaming event, and she really put me in the spotlight and kind of pointed out all these things that were wrong with me, and that if I only lost some weight, joined this Weight Watchers program, everything would be so much better. And I remember feeling so ashamed and mortified and just honestly also very confused. I went in there thinking that she's a doctor who's going to solve ailments and help me get better, but instead she was making me feel so much worse. And this feeling lingered. I remember I went to breakfast with my mom right after, before she took me back to school, and I could not eat. The plate, I just was staring at it, and my mom didn't understand why. And then later that day when I went back to school, I could not focus on school at all. And I remember for a very long time, I just remember going back to school and thinking, what are these people around me thinking about me? If this doctor who doesn't even know me is thinking these things and pointing out these things about me. So her comments made a very lasting effect on my self-esteem, how I thought about myself, and my confidence. And I then made an even stronger vow to avoid going to the doctor. And it wasn't until I was 16 and I had a very bad infection with a fever, and I just could not eat and I could not sleep, that I finally went back to the doctor again. And so I avoided getting medical care, which could have turned out to be a pretty serious problem because of those doctor's words, and honestly, not just that doctor, but all the other comments that came before then. And I certainly have thinner body privilege now, but I vividly remember being so terrified of nurses and doctors saying those things about my body and my weight, because I knew how much they affected my mental health, my self-esteem, my confidence. And this is just a really horrible problem that continues to happen to anybody at any age, and it's something that needs to change.
Interim solution. Until social and medical perceptions around weight are changed, here are some steps to take before seeing your physician. First, see if you can find a Health at Every Size doctor at healthateverysizecommunity.com. These healthcare providers are weight inclusive and are weight neutral when it comes to treatment. You can search by state and county, finding what is best for you and closest. Ask if a doctor has practice from a Health at Every Size perspective. And before making an appointment, ask about policies on being weighed and the patient advocacy they provide. Lastly, find local resources via social media platforms. There is a community of people who are experiencing the same type of discrimination. And we are doing everything we can to assure that it never happens again. But until then, here are some resources and education about the issue of weight discrimination and fat phobia in the healthcare field. Websites include healthateverysizecommunity.com and fatfriendlydocs.com. Here are also some books to educate oneself on the issue of weight discrimination, the issue of health when it comes to weight, and the issue of fat phobia, specifically in the healthcare field. These books include Health at Every Size by Lindo Bacon, Fearing the Black Body, The Racial Origins of Fat Phobia by Sabrina Strings, and What We Don't Talk About When We Talk About Fat by Aubrey Gordon.